our live session today, guys. Hello, everyone. Uh, Guys, so let's just understand why we are doing this, because from 4th of April or May, 4th of May, we are having exams, right? First of all, the third semester, those who have already completed their clinical anatomy, they will have their exam. After that, the fourth semester, who is having their exams right now, uh, who is having their classes right now, they will have their exams, right? So what I am thinking is ki whatever I have taught you in the classes, let's revise it again. And I hope the voice is coming nice and clear, guys. They're like, I can't see. So if you will tell me that the voice is coming good, then we will go further. Great, great. So in your exams, you will have two sessions, right? In first session, you will have pre-CBT, and in second session, in between, we will have break. After break, we will have Viva, right? Pre-CBT, all of you guys, the same MCQ questions which are there in the module. You have to read the PDF, you have to answer it. For passing, it will be around 72 marks. So 72 to 80, it will be 3 marks. 82 to 90, it will be 4 marks. And 92 till 100, it will be 5 marks. And those who will get this number, they are the most luckiest one, right? Then we will have Viva. From after break, what we are going to do, we are going to have Viva, and Viva will be also of 100 marks, guys. In this, you will have 5 questions, each of 20 marks. Now it depends on the teacher, how the teacher will ask all these questions. Those who are my students, for them, it will be in each 20 marks, I will give you four different questions, which will be of around 5 marks, right? So in these 4 questions, I will ask you upper limb. Then in next 4 questions, maybe lower limb. Then in next, I can ask you headache or the GIT. And in these 2 questions, I will make you revise your anatomy. Okay, that's how we are going to have this paper. For that, what we are going to do, we are going to revise today the upper limb. Whatever I have taught you in the class, this class will be approximately the same class, but it will be in a rapid session so that we can finish everything early, right? Let's start, guys. I hope everyone is here. I hope everyone is liking. Again, hello everyone. Thanks for coming. I think around 22 people are here. Thank you so much, guys, for having me in this night time. So today we are going to do what, guys? Today we are going to do upper limb. In upper limb, how many bones are there, guys? First of all, we should know the names of the bones which are present in the upper limb. The upper limb is starting with clavicle. Then we are having scapula, humerus. Then we are having ulna, radius. And then we are having what, guys? The carpal bones. In carpal bones, what we are having? She looks too pretty. Try to catch her. Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. Important is what, guys? In here we will find, first of all, we are having scaphoid. Scaphoid is the most common hand bone which will get fractured. It is the most common hand bone which will get fractured. Then we are having lunate. Lunate is the most common bone which will get dislocated. Then the lunate, which is the most common bone, can get dislocated. Then we are having one imported bone, that is pisiform. Pisiform is last to ossify and as well as it is the smallest bone. Okay, guys. Then we are having the largest bone. That is what, guys? That is your capitate. And the last bone which we should know here is your lunate. In lunate, we are having the hook of lunate. And this hook of lunate, we are having what? We are going to have one nerve. Can you guys tell me this name of the nerve, guys? Which nerve passing through hook of hamate? Hook of hamate. I'm waiting for your replies, guys. Anyone who wants to comment. Great. It's ulnar right? Good. Then after the carpal bones, we are having metacarpals and then phalanges. Guys, important. Today also I asked in my rework session one student, what are phalanges and how many phalanges do we have? He was confused in this easy question, guys. So for 4 fingers, we are having 3 phalanges. Nearest one is proximal. Proximal का मतलब क्या है, guys? पास वाली. जो भी आपकी बॉडी की मिडलाइन के पास में है, that is what, guys? That is your proximal one. जो भी आपकी बॉडी से दूर है, that is what, guys? That is your distal one. So D for distal, D for दूर. Right? जो भी आपकी बॉडी से दूर है, this is the farthest one of from your body's midline. That's why it is what, guys? It is distal one. Important to know here is that the thumb is having what, guys? Thumb is having only 2 phalanges. In these 2 phalanges, one is proximal and one is distal one. Here we are having in the middle, that is the middle proximal. So middle phalanges, that is your middle phalanges. It is extra in 4 fingers, but in thumb we don't have the middle phalange. That's why in total we are having how many, guys? 12 plus 2. Total we are having 14 phalanges in 1 hour. Great. Now let's study all these bones, all the important bones among these one by one, right? So first of all, what we are going to start? We are going to start the clavicle. In clavicle, guys, see, this end here is the sternal end and this end here is the acromion end. How to differentiate between the sternal and the acromial end, guys? The sternal end is oval shaped end and the acromial end is flat end. Okay. Next is what, guys? The superior surface, S for superior, S for smooth. Superior surface of clavicle is smooth. The inferior surface is what? It is your rough surface. That's why we are having 1, 2, three, and four bony landmarks on your inferior surface. The first one, if we will start from the sternal end, the first one is what, guys? It is costal tuberosity. Then you are having the subclavian groove. It is very important one. Why? Because from here subclavian artery and subclavian vein is going, right? Then we are having conoid tubercle and trapezoid line. Total we are having four different things. This clavicle is also known as the collarbone or the beauty bone. If you'll see it with the naked eyes in girls, the girls are beautiful. But if you'll see it in boys, right, the boys are malnourished. If only in boys you will see the clavicle. Which boys, guys? These are pediatric patients. So sometimes when you are working in a small government hospital in CHC, PHC, right? You don't have enough amount of instruments to find the malnutrition of the child. So in that we will see first of all this clavicle, as well as we will see the backbone. If all the vertebrae are very prominent at the back of this baby and all the ribs are easily visible in this baby, we will say that the baby is malnourished. Okay. This only watching the clavicle is not one factor. It is one of the factor, right? Then it is the first bone which is going to start the membranous ossification. This membranous ossification will start from when, guys? It will start from 5th to 6th week of intrauterine life. And when it will finish on the 45th day of intrauterine life. It is the only long bone which is having two primary ossification. It is the only long bone which is having how many, guys? Two primary ossification centers. Can you see these two purple dots here, guys? These two purple dots are what, guys? These are the primary ossification, right? These are primary ossification center. From this center only your bone will start getting developed. अगर इंग्लिश में ज्यादा हो जाए तो बता देना, हिंदी चालू कर देंगे अपन, है ना? It is the bone in which you are having the piercing, and this piercing is done by what, guys? This piercing is done by middle supraclavicular nerve. This piercing is done by middle supraclavicular nerve. What are the important landmarks? We have already discussed it. Let's discuss it again, guys. It is subclavian groove. This subclavian groove is what, guys? This subclavian groove is having subclavian artery and subclavian, right? Then we are having the trapezoid line and the conoid tubercle. They are present laterally anterior to the inferior surface, and from here you are having coracoclavicular ligament. It is a ligament which is attached where, guys? It is attached to the trapezoid line and the conoid tubercle. This ligament is attaching between coracoid process as well to from coracoid process till lateral end of the clavicle. Then we are having the shaft which is convex from the anterior side. Then the medial 2/5 of the anterior surface provide what, guys? It is providing the attachment to the clavicular head of pectoralis major muscle. Can you see this, guys? This muscle here is what, guys? This is your pectoralis major muscle. In this muscle, if you will see the anterior 2/5 part of the clavicle, medial 2/5 anterior surface is covered by what, guys? It is covered by this muscle. The name of this muscle is pectoralis major muscle, right? The name of this muscle is what, guys? Pectoralis major muscle. Then this is very important here. It is what, guys? So we are having the clavicle. In this clavicle, we divide this clavicle from medial 2/5 and the lateral 3/5. Sorry, medial 3/5 and so from medial side till lateral side, it is medial 3/5 and lateral 2/5. So I have told you about two primary ossifications. These two primary ossifications will develop like this, and the weakest point of this clavicle will be what, guys? The weakest point of this clavicle will be medial 3/5 and the lateral 2/5. This is the place from where your clavicle is going to get fracture. Most common fracture is from medial 3/5 and lateral 2/5, right? So once if you are having the fractures of the clavicle, guys, try to understand what I'm telling you. So once you are having the fractures of clavicle, what you will do with this person, guys? This person will come to the hospital. First of all, you will try to treat this person with a thing. That thing is known as what, guys? That thing is known as figure of eight bandage, right? Once we'll do this figure of eight bandage thing with the patient, we will tell the patient to have a minimal bed rest for around 3 to 5 months. In that period of time, if your clavicle is getting joined with each other, very good. But what can happen sometimes, this clavicle can have malunion, right? If the person is having this malunion kind of thing in the clavicle, what we are going to do, guys? We are going to do the surgery. This surgery is known as what, guys? ORIF, open reduction internal fixation. Open reduction internal fixation, ORIF. This is the kind of surgery which we are going to do to the person who is having clavicle fracture. If we are doing surgery, of course, we are going to have some kind of complications, right? Can you tell me in the comments what are the complications which can happen from the surgery which we are doing to join the clavicle? Brachial plexus, bro, brachial plexus is on the posterior side, right? How it will get damaged? I understand brachial plexus is something related, but it is not the perfect answer which you can give to a teacher, right? Anyone who wants to try, guys, please, I'm waiting for the comments. Rupture of the subclavian artery, okay, good approach. Subclavian nerve artery, okay, guys. So try to understand what we are going to have when we are doing this operation. Suppose this is my clavicle here, okay. We already have studied that on the inferior side of the clavicle, I am having subclavian groove. In this subclavian groove, I am having subclavian artery as well as subclavian vein, right? So this artery at the time of operation, it can get damaged, it can get ruptured. That is a correct thing. But as well as try to understand, guys, this artery is directly connected to the arc of aorta, right? And arc of aorta is connected to what, guys? It is connected to your heart. So if a arc of aorta is connecting to your heart, then the supply and the blood which is coming here in this subclavian artery, the pressure of this blood will be very high, right? If the pressure of the blood is very high, what will happen? The patient will lose so much amount of blood. We call it what, guys? We call it hemorrhage. And if patient is going into the shock because of this hemorrhage, this is known as what, guys? This is known as hemorrhagic shock. So at the time of operation, the patient can go in what, guys? The patient can go in the hemorrhagic shock. As well as here we are having the starting point of the main or the major branches of the brachial plexus. If you have studied my, if you have taken my classes, you have seen that after brachial plexus, I have told you 5 major branches of brachial plexus, which we are going to discuss today also in the end of this topic. In these 5 major branches, the roots or the starting point of these 5 major branches is also near to the clavicle, right? So it can happen, guys. Because of the operation, all these 5 major branches can get ruptured or can get damaged, right? They will have some kind of injury and the patient can go in permanent paralysis of the any of the branches, either the musculocutaneous or the radial or the ulnar, whatever the thing is. Okay, done. Fracture, this fracture will look like this, guys. Can you see? Here I am having what, guys? This point here is my sternal end, right? This point here is my acromial end, and somewhere from the medial 3/5 and the lateral 2/5, it is going to get it got fractured, right? It is the most common fracture which will happen in the human body. It is very important point, guys. The most common fracture which will happen in this human body is what, guys? It is your clavicle. After the operation, this person will look like this, guys. So we are going to do, guys, we will do open reduction, internal fixation. In internal fixation, we are going to use what, guys? Plate and the nails. This is your figure of 8 bandage, right? Then the next bone is scapula. Scapula is important, guys. At the time you are giving the viva, maybe you will have some kind of bones in front of you, right? And teacher's favorite bone is scapula. Let me be honest with you, because it is having so many things in it. You should know the upper border, the lower border, lateral border, middle border. On the anterior side, what all muscles are there? On the posterior side, what all muscles are there, right? Then on the this here, can you see this is your glenoid cavity, which is going to join with your head of the humerus, will make the shoulder joint and all those things. So all these things, all these bony landmarks are important. Just revise it once for your final exams, okay? If you want 4 marks. Now, the upward movement of the scapula is done by what, guys? The upward movement of the scapula will be done by your levator scapulae muscle. It will be done by what, guys? It will be done by your levator scapulae muscle as well as the upper trapezius muscle. Levator scapulae muscle as well as what, guys? It will be your upper trapezius muscle. The downward movement of the scapula will be done by your lower trapezius muscle. Then the adduction towards the midline, this kind of movement will be done by medial trapezius and the rhomboid muscles. Then you are having adduction away from the midline. It is done by what, guys? Serratus anterior muscle. This serratus anterior muscle is also known as what, guys? Serratus anterior muscle is known as, anyone can comment? मैंने लिख दिया है यार, छोड़. It is, guys, boxer's muscle. Serratus anterior is your boxer's muscle. Then the down upward rotation. So the it is going like this. Upward rotation is done by middle and the trapezius muscle. The downward rotation is done by what, guys? Again, the rhomboid muscle. This clinical application, guys. So what we are going to study now, we are going to study about the congenital high scapula. What is congenital high scapula, guys? So at the time of development of the baby in the intrauterine life, sometimes what will happen, this scapula, which is, if you are in the uterus, right, the scapula will be somewhere here, but at the time of development it will come to its natural position. But in some babies it will not come. It will get attached with what, guys? It will get attached with the fibrous tissue, cartilage and the bone. This bone is also known as omovertebral body. From this thing it will get connect. On which place it will connect? It will connect on the cervical vertebrae. It will connect where, guys? It will be connect by the cervical vertebrae, and the band which is going to connect this thing is made up of fibrous tissue, cartilage and the bone, which is omovertebral body, right? If only option to do correct this thing is, guys, to do a surgery, we are going to have a surgery on this place, guys. Because of that surgery you can have the damage in your brachial plexus. You can have the damage in what, guys? Brachial plexus. This is your FMG exam question also, guys. This question is what, guys? This is about the winging of the scapula. Read the question, guys. What is the question? After the overhead weightlifting exercise, patient developed the following deformity, and this following deformity is looking what, guys? It is looking like winging of scapula. This winging of scapula is done, it is due to what, guys? It is due to paralysis of serratus anterior muscle. It is due to the paralysis of serratus anterior muscle. This serratus anterior muscle is supplied by long thoracic nerve, right? This serratus anterior muscle is supplied by long thoracic nerve, as well as what all nerves going to take part in winging of scapula. These are your serratus anterior, trapezius muscle, rhomboid major, and rhomboid minor. What we have studied about rhomboid major, guys, just before 2 minutes? Anyone who can answer? Before 2 minutes, what we have studied about rhomboid major? It is connected with clavicle on which side? Anterior side, medial 2/5 or 3/5? Medial 3/5, anterior side. This rhomboid major is going to connect with the clavicle, right? Then very important topic, guys, it is your rotator cuff muscles. How to remember the rotator cuff muscles? The mnemonic is sits. So we are having what, guys? We are having sits muscle. What are sits muscle, guys? Supraspinatus, infraspinatus, teres minor, and subscapularis. Out of them, supra, infra, and teres minor is what, guys? It is the posterior group of muscle, and subscapularis is what, guys? Subscapularis is your anterior muscle. अच्छा हाँ, वो pectoralis था भाई, sorry. Now, what we have studied, guys, supra, infra, and teres minor is your posterior group of muscle. Where is my supra, infra, and teres minor, guys? Here, can you see? This is my supraspinatus, infraspinatus, and teres minor. All these three muscles are attaching to what, guys? They are attaching to the greater tubercle. And starting from what, guys? Starting from the medial side of the medial posterior side of the scapula, right? And the subscapularis, which is the anterior muscle, is attaching where, guys? It is attaching to the lesser tuberosity of the humerus. Supraspinatus is the most common injured muscle in the rotator cuff. Which muscle is most commonly injured, guys? It is your supraspinatus muscle. The nerve which is supplying to the supraspinatus muscle is what, guys? It is your suprascapular nerve. The function is what, guys? The function is initiation of the arm abduction. So when your arm is starting abducting, right? The initiation, which is what, guys? Which is around 0 to 15 degree, is done by what, guys? It is done by your supraspinatus muscle. Abduction of the shoulder, it is 0 to 90 degree, it is by supraspinatus as well as the deltoid muscle, and more than 90 it is serratus anterior and trapezius muscle. Please remember this thing, guys, it is very important. Then we are having infraspinatus muscle. Infraspinatus muscle is by the suprascapular nerve, and the actions are what, guys? Actions are external rotation of the arm. Then we are having teres minor, guys. It is supplied by the axillary nerve, and it is doing what, guys? It is doing the abduction and the external rotation. After that, we are having tuntun mosi of this rotator cuff muscle, guys. Who is tuntun mosi? Tuntun mosi means what, guys? It is the bulkiest muscle of your rotator cuff. It is what, guys? It is your subscapularis muscle, also the only anterior muscle in your rotator cuff, right? It is the bulkiest muscle. It is supplied by upper and lower subscapular nerve, and only muscle which is doing adduction and internal rotation. It is also known as the forgotten muscle of the rotator cuff. Also known as what, guys? The forgotten muscle of rotator cuff. Then we are having shoulder joint. Shoulder joint is again very important topic, guys. So the fourth question in your viva can be the shoulder joint, guys. Ligaments of the shoulder joint. It is also known as glenohumeral joint. It is the multi-axial ball and socket joint. The head of the humerus is articulating with the glenoid cavity of the scapula. What are the ligaments which are helping to make this shoulder joint, guys? First of all, can you see this fibrous tissues on the head as well as on your glenoid cavity? These fibrous tissues are the first ligament, name is fibrous capsule. Okay. Then we are having glenohumeral ligament, glenoid cavity to the humerus. This is your glenohumeral ligament. This ligament is having what, guys? This ligament is having superior, medial, and inferior parts. It is giving the stability of the shoulder joint towards the anterior side. So when you are doing bowling and sometimes you are having what, guys? The shoulder is coming out, right? So it is what, guys? It is due to the weakness of your glenohumeral ligament. Then we are having coracohumeral ligament, which is from the coracoid process of the scapula to the anatomical neck of the humerus. This is your coracohumeral ligament, right? Then we are having the synovial membrane between the two tubercles. And between the two tubercles, the place where your synovial membrane is present, guys, this thing is known as what, guys? Here, this thing is known as what, guys? This thing is your intertubercular sulcus. It is my favorite question, guys. Intertubercular sulcus. In this sulcus, what is happening, guys? Can you see this synovial membrane? This synovial membrane is around what, guys? It is around the tendon of the biceps brachii. Can you tell me which tendon is it, guys? This tendon is from the long head or the short head? Anyone who can answer it, guys? Good. It is of long head. Long head. Sometimes what will happen? It will get fracture, and the patient will have Popeye deformity, which we are going to study in few seconds, right? What all are the ligaments, guys? So we have studied about coracohumeral ligament, that is this one right here. We are having one more ligament, this one. This is what, guys? This is your coracoacromial ligament. Then we are having acromioclavicular ligament, right? The fibrous capsule we have already discussed. Then we are having this ligament. This is your coracohumeral ligament. In between. Okay, so first of all, we are having this intertubercular sulcus. In that, we are having long head of the biceps tendon. Then we are having the synovial membrane, and above that, we will have one ligament. This ligament is what, guys? Transhumeral ligament, right? Then, what all are the ligaments? I think everything is covered. Here, it is what, the guys? It is trapezoid part of the coracoclavicular ligament. Done. Then we are having, guys, glenoid labrum. In glenoid labrum, what is it, guys? It is the fibrocartilaginous rim which is around the glenoid cavity. It depends what, guys? It depends fossa which forms like a pillow. तकिए की जैसा लगता है इसको head of the humerus को. So if you are having some kind of rubbery thing here, right? So it will give me the lubrication so that my head of the humerus can move easily, right? Now another thing is what, guys? This is your subacromion bursitis. It is also my favorite topic, guys. What is subacromion bursitis? So below acromion process, we are having this gap. In this gap, we are having some synovial fluid, right? This synovial fluid is covered into a cavity, and that cavity is known as what, guys? That cavity is known as bursa. This bursa is present below the acromion process. That's why it is subacromion bursa. When this bursa will get any kind of inflammation, we will call it subacromion bursitis. Why this inflammation can happen? This inflammation of the bursa is due to the deposition of calcium within the supraspinatus. It is the deposition of the calcium in the tendons which are present around this bursa. Understood, guys? In this subacromion bursitis, we are going to see one sign. That sign is what, guys? That sign is Dowburn sign. So in Dowburn sign, what you are going to do, the patient will put his hand up. The abduction of the patient hand, it will not have any kind of pain. Pain will be absent, right? But when you will put his hand down, adduction, at that time, he will have pain from 50 degree to 130 degrees. Done, guys? See, Popeye deformity. Popeye deformity is what, guys? It is the rupture of the long head of the biceps muscle, which is present where, guys? Which is present in your intertubercular sulcus, which is present in your intertubercular sulcus. So from there, the long head of the biceps muscle or the tendon which is present at the long head of the biceps, which is present at the intertubercular sulcus, it will get rupture. Because of that, the long head will come and collect inside your arm, and it will look like the muscles of a Popeye. That's why we call it Popeye deformity, right? Then we are having Pushpa uncle. Pushpa uncle is having what, guys? Pushpa uncle is having drooping of the shoulder. Drooping of the shoulder is done by which muscle paralysis? Which muscle is included in this, guys? The muscle is trapezius muscle. Okay, trapezius muscle is going to get paralyzed, and because of that, we are going to have drooping of the shoulder. And this drooping of the shoulder, this trapezius muscle, is supplied by spinal accessory nerve. It is supplied by which nerve, guys? Spinal accessory nerve. Now we are having humerus again, the head of the humerus, greater tubercle, lesser tubercle, intertubercular sulcus. Then after intertubercular sulcus, on the posterior side, we are going to have this groove. This groove is known as what, guys? Radial groove. Then we are having olecranon fossa, lateral epicondyle, medial epicondyle, medial supracondylar ridge, body, shaft, deltoid tuberosity is on the anterior side, guys. Deltoid tuberosity is on anterior side, then surgical neck, anatomical neck, right? It is the strongest bone of the upper limb. Radial fossa is important, guys, because it is a very small depression which is lying laterally to the coronoid fossa above the capitum, and it lodges the head of the radius during the elbow flexion. Important is the nerves which are there on the humerus, right? One important question, guys. Most common fracture of this bone is on which place? So from which place it will get fracture, guys? Anyone who can answer? Anyone who can answer, guys? Okay, okay. It is your surgical neck. So from the surgical neck of the humerus, it is going to get fracture most commonly. Once it is getting fracture from the surgical neck, what you should know, guys, on the surgical neck we are having one nerve also. This nerve is known as axillary nerve. There are very high chances that at the time of the fracture, this nerve will get damaged. This nerve will get the lesions, right? So what, there can be two types of question. Most common fracture of the humerus, that is surgical neck, right? Second question what they can make, the person is having fracture in the bone, and they will give you one x-ray which I'm going to show you in some time, which nerve can get injured, that is your axillary nerve. Then what they can say, this axillary nerve is supplying to which or muscle, which we are going to study in the brachial plexus, right? If my shaft of the humerus is getting fractured, we have studied what, on the posterior side of this we are having radial groove. From radial groove, my radial nerve behind from the humerus going to pass. So if shaft of the humerus will fracture, the sharpened points of the sharp can damage the radial nerve. If it is getting fractured from the medial epicondyle, it is your ulnar nerve. Then here we are having what, guys? Here we are having cubital fossa. In cubital fossa, we are having four different things. What are the contents? Contents are M, B, P, S. From medially to laterally, right? This is my medial epicondyle. This is what, guys? This is brachial artery, biceps muscle tendon, and superficial radial nerve. Superficial radial nerve. All these things are what, guys? All these things are my four contents of cubital fossa. Great. See guys, that's how your surgical neck is going to get fractured. This is the proper X-ray where you can find the fracture of surgical neck. So if my surgical neck is getting fractured, the patient can have what guys? Axillary nerve injury. This axillary nerve supplies to deltoid muscle. So at the end, what can happen? At the end, the patient can have deltoid muscle paralysis. And this deltoid muscle paralysis, one sign which you are going to see, this sign is what guys? This sign is known as flattening of the shoulder. This sign is known as flattening of the shoulder. Then the second thing is what guys? Second is my shaft fracture. So if the shaft of the humerus is getting fractured, what will happen? Wrist drop. Radial nerve paralysis will lead to a deformity, and this deformity is known as wrist drop. The third fracture which is happening where guys, which is happening on the medial side. Guys, see, यहाँ पे एक बहुत छोटा सा एक्सरे दिया हुआ है ना? इस एक्सरे में तुम कैसे पता लगाओगे कि विच साइड इज मीडियल एंड विच साइड इज लेटरल? इजी ट्रिक है। हम बहुत बार कंफ्यूज हो जाते हैं हमारे रेडियस और अल्ना में भी। यहाँ पे भी आपको पता नहीं चलेगा ढंग से कौन सी रेडियस कौन सी अल्ना। क्या करना है, दिमाग में एक चीज बनानी है, एम फॉर मीडियल, एम फॉर मीडियल एंड एम फॉर मोटा। जो भी मोटी साइड है, जो भी साइड ओवरली आउटसाइड निकली हुई है, सी गाइस दिस इज मोर इनसाइड, दैट इज आउटसाइड, राइट? So the side which is outside, that is the medial side. The side which is inside, that is lateral side. So can you appreciate this fracture guys? I am going to have what guys? I am going to have medial epicondyle fracture. Medial epicondyle fracture is what guys? It is damaging my ulnar nerve. It is damaging my ulnar nerve. Can you appreciate this diagram guys? Here this is my medial epicondyle which is coming outside, this is my lateral epicondyle which is inside, and this nerve here, this nerve is which nerve guys? This is my ulnar nerve. So medial epicondyle fracture, this medial epicondyle fracture here, this is my ulnar nerve. This medial epicondyle fracture can have ulnar nerve injury. बोलते बोलते गलत कर रहा हूं मैं। medial ulnar nerve paralysis can have partial claw hand. Ulnar nerve paralysis can have what guys? It can have the partial claw hand. Next kind of fracture, can you see this fracture guys? This is the most dangerous fracture of your humerus bone. Most common is what guys? Most common is, just now we have studied, anyone can answer? Already there na? It is the surgical neck. And what is the most dangerous fracture guys? This is the most dangerous fracture. Can you tell me the name of this fracture guys? We are talking about humerus. Most common fracture in humerus and most dangerous fracture in humerus. Okay, okay, I'm getting the answers. Yes, it is what guys? It is your supracondylar fracture guys. This is one of the most dangerous fracture. Why? Because we have already studied about cubital fossa. In cubital fossa, we are having brachial artery. This brachial artery can get ruptured. If this brachial artery will get ruptured, I will have so much swelling and the hematoma on this place, right? As well as this fracture is having very high risk of malunion. What we are having guys? We are having the risk of malunion. Because of that, this kind of patient will have a deformity, and name of that deformity is gun stock deformity. Can you appreciate this thing guys here? This is looking like a gun, right? We call it gun stock deformity. We call it what guys? Gun stock deformity. When this will happen? At the time of healing of this fracture, this person will have the malunion. Because of that, you will have gun-stalk deformity. Gun-stalk deformity, the clinical name is what, guys? The key clinical name is cubitus varus. What is the clinical name, guys? Cubitus varus. You should know the difference between cubitus varus and cubitus valgus. This will be your exam question. Okay, I have told you in the class. Cubitus varus versus cubitus valgus. In supracondylar fracture, we can have the medial nerve injury as well as the brachial artery rupture, which will give me what? Which will give me the hematoma. And if this fracture is the closed fracture, we can have this kind of sign, and this sign is known as what, guys? Double elbow sign. Double elbow sign. Done. Now we are having one question, guys. Already we have discussed this thing. What is this question, guys? Can you tell me? This is a patient presented with the deformity as shown in the image. The X-ray was even you don't know the options, guys. Then also you can answer it. It is the shaft of the humerus, right? So the shaft of the humerus is getting fractured, and the person is having this kind of sign, which is known as wrist drop. Definitely, it will be which nerve? It will be your radial nerve, right? Now tell me, guys. This is the medial epicondyle. Which nerve is going to supply here, guys? What is the nerve which is going to supply from the medial epicondyle? It will be ulnar nerve. Good. This is your cubitus valgus, guys. Cubitus valgus will be seen in ulnar nerve fractures. So if your ulnar nerve is getting fracture, you can have cubitus valgus. And gun-stroke deformity is seen in supracondylar fracture. Then we are having elbow joint, guys. Elbow joint is your humero-ulnar joint, humero-radial joint, and proximal radio-ulnar joint. Okay. The involvation of pronation and supination. What is pronation? What is supination is also my important question, guys. This I asked as the fourth question. What is pronation and what is supination? The nerves which are involved in the elbow joint is musculocutaneous nerve, median nerve, radial nerve, or ulnar nerve. These four are what, guys? These four nerves are the major nerves of your upper limb, right? Plus one more muscle is there, guys. Which muscle? Total we are having five major muscles. Out of them, one, two, three, four is here. Which one is the fifth nerve, guys? Can you tell me? Musculocutaneous is there, median is there, radial is there, ulnar is there. Which nerve is not going to be? Of course, it is the axillary nerve. Here also we have written that elbow joint is having all these nerve except the one nerve, the name of that nerve, and it is also a major nerve, that is axillary nerve. Then we are having the ligaments of the elbow joint. Can you see this green color ligament? Acha, first of all, see, guys. We are watching the hand from the both sides. Okay. One is, if my hand is like this, so this is the anterior side and this is the posterior side. So we are going to watch it from the both sides. The green color thing which you can see here and here, this green color thing is what, guys? This is your annular ligament. Annular ligament. We will study about this ligament, guys. It is important, right? Annular ligament. This ligament is, guys, sling-like ligament which straps around the radius to ulna. It protect radius, even to be specified the head of the radius from the dislocation during the movements. Okay. Then we are having this pink color ligament, guys. What is the pink color ligament? It is your fibrous articular capsule. Then we are having ulnar collateral ligament, radio collateral ligament, Now we are having radial head fracture. Radial head fracture will happen due to the fall on outstretched hand. On x-ray, most significant finding which you can get for the radial fracture, it is what guys, you are going to find the fat pads which become pushed up by the fracture. Can you see guys, here I am having the fat pads which are pushed because of the fracture, right? Now let's see these things guys. We are having two different kind of elbow. This is also my favorite question guys. I ask you four different elbows. Tell me about four different pathological elbows. Can you tell me all these four names guys, first of all, then we will discuss it. Okay, so one of them is student elbow. Very good. Tennis elbow. Golfer's elbow. Good. One more is remaining guys. What is that? Very good. It is pulled elbow. All these are my four different elbows. We are going to study about this guys. So the first is what guys? First is my lateral epicondylar inflammation. Inflammation of lateral epicondyle is giving me what guys? It is giving me the tennis elbow. Inflammation of medial epicondyle is going to give me the golfer's elbow. Tennis elbow, lateral epicondyle, golfer's elbow, medial epicondyle. Okay, then we are having the pulled elbow. In pulled elbow, usually we see pulled elbow in what guys? In the pediatric age group patients. So small babies, they will have weak joints, right? So if someone is pulling them like this auntie, she is the culprit here, right? So if she is pulling her hand like this, what will happen? The elbow will get dislocated. We call it pulled elbow. What will happen? The head of the radius will be pulled out from the annular ligament. The head of the radius will be pulled out from annular ligament. Just now, before 2 minutes, we have studied about annular ligament. That will be also a very important question, that what is the importance of annular ligament, right? Then we are having student's elbow. In student's elbow, another name of the student's elbow which no one has told me, that is the minor's elbow. Another name of student's elbow is what guys? It is minor's elbow. What we are going to have? We are going to have olecranon bursitis. Again, the calcium will come to the nearby tendons. Why? Because students have this tendency to put their hands like this, right? So what will happen? The olecranon bursa will get bigger. Cubital fossa, again very important topic guys. We are having the medial boundary and the lateral boundary. Medial boundary is what guys? It is the lateral border of pronator teres muscle. It is lateral border. Don't forget the lateral border guys. Lateral border of pronator teres muscle. Then the lateral boundary is what guys? It is medial border of brachioradialis muscle. What are the contents guys? Contents are MBBS here. Already told you about this. Median nerve, brachial artery, biceps brachii tendon, and superficial radial nerve. Okay. If you want 5 marks, then you will study about the floor and the roof also. We are having Monteggia and Galizzi. What is Monteggia and Galizzi, guys? First of all, they are about the fractures of your ulnar as well as the radius. So in Monteggia, we are going to have everything on the proximal side. First of all, remember this. Okay. Then you are going to have ulnar bones fracture and radial bones dislocation. If my ulnar bone is getting fractured and radial bone is getting dislocated from the proximal side, it is what, guys? It is Monteggi. If my the opposite of Monteggi is Galeazzi. So on my distal side, I am having ulnar bones dislocation and radial bones fracture. It is Galeazzi, right? My students, management for Monteggia and Galeazzi important. Okay, that's how they look, guys. This is my Monteggia fracture. This is the Galeazzi fracture. What is happening in Monteggia fracture, guys? In Monteggia fracture, I am having the proximal side of the hand, ulnar bone fracture, and radial bone is getting dislocated. In Galeazzi side, what is having, guys? This is my radial bone, which is getting fracture from the what, guys? From distal side, I'm having the radial bone fracture, and this ulnar bone is getting what, guys? It is getting dislocated, right? Again, two more fractures, guys. Colles fracture and Smith fracture. Colles fracture is outstretched hand. Smith fracture is flex wrist. So when you flex your wrist and your whole body weight will come here, it will be Smith fractures. When your whole body weight will come here on the outstretched hand, it will be Colles fracture. Okay, guys. If you will have any kind of FMG exam question related with the Colles fracture or the Smith fracture, one thing they will definitely give, that is the dinner fork deformity. So dinner fork deformity is seen in Colles fracture, and garden spade deformity, it is seen in where, guys? It is seen in your Smith fracture. It is seen in your Smith fracture. Great, guys. Now muscles of arm and forearm. Let's start. Is class going good? Is there any kind of lagging or something which you are not appreciating? Please let me know what I can improve. Everything is going good, guys. Are you all awake? 16 बच्चे जिंदा हैं अभी तक. क्या बात है. बढ़िया बढ़िया. 2 मिनट का ब्रेक ले लें यार, मेरा गला दुखने लग गया. 1 घंटा हो गया बोलते बोलते. रिवाइज कर लो, गाइस, जो भी अपन ने पढ़ा है ना अभी तक. जितने में बातें भी कर लूंगा तुम लोगों से. ऑल गुड, ऑल गुड. बढ़िया. अभी तक जो भी पढ़ा है, कहीं पे कोई प्रॉब्लम आई हो, कुछ क्वेश्चन हो तो पूछ लो, गाइस. फिर अपन मसल से स्टार्ट करेंगे. Any problem until now? Can we start further? Or you want to ask something? ये हटा देते हैं ना इसको, टेलीग्राम का जो ये है. आई थिंक इनफ हो गया है बस. हमें एक्स्ट्रा स्पेस भी मिल जाएगी पढ़ने को. Okay, guys. So let's start the muscles of arms and forearms. First of all, arm. Arm is having two kind of compartment, guys. One is anterior compartment and another one is posterior compartment. Okay. In anterior compartment of the arm, you will see what all muscles, guys? You are going to see the long head of the biceps muscle, short head of the biceps muscle, coracobrachialis, brachialis, and aponeurosis of the biceps, right? The long head is going to passes through intertubercular sulcus, which we have already discussed. The origin of the long head is what, guys? It is supraglenoid tubercle, and the origin of the short head is what, guys? It is coracoid process. Insertion is same, that is radial tuberosity. Then we are having coracobrachialis muscle. In this, origin is coracoid process of the scapula, and insertion is shaft of the humerus on the medial side. Okay. Brachialis muscle origin is shaft of the humerus, insertion is ulnar tuberosity. It forms the floor of the cubital fossa. Then we are having this cut, which is of the biceps aponeurosis. It is merging with the roof of cubital fossa. Great. Then we are having forearm. In forearm also we are having anterior compartment and posterior compartment. The most common origin is what, guys? It is your medial epicondyle. So the anterior compartment of the muscles which are in the forearm, they are divided into three parts: superficial, middle, and deep. In superficial, how many, guys? Total we are having four muscles. What are these four muscles? First of them is pronator teres. Then we are having flexor carpi ulnaris. Then we are having flexor carpi radialis. And the last one is palmaris longus. In medial layer, we are going to have the flexor digitorum superficialis. And in deep layer, we are going to have flexor digitorum profundus. Then we are having flexor pollicis longus. All these are the muscles of the anterior compartment, right? In the posterior compartment, we are having again what, guys? First of all, posterior compartment of arm. In posterior compartment of arm, we are having only the one muscle, that is triceps brachii muscle. This is having three heads: medial head, lateral head, and the long head. The largest head is what, guys? The largest head is medial head. Origin is infraglenoid tubercle. So infraglenoid cavity. The posterior compartment of forearm, they are having again the superficial and the deep muscles. डीप की फोटो नहीं है क्या ये रही. We are having extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor carpi ulnaris, and extensor digiti minimi. Okay. In the deep layers, what we are having extensor indicis, abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. All extensors are my posterior side of muscles. All flexors are my anterior side of. Great. Anatomical snuff box. It is the very favorite topic in your anatomy, guys. In anatomy snuff box, the main content which you should know is what, guys? It is the radial artery. The main content is what, guys? Radial artery. The roof of anatomical snuff box is your FMG exam question, guys. So which vein is going from the roof? It is your cephalic vein in the superior branch of radius, superficial branch of radius. These both are making the roof of anatomical snuff. Carpal tunnel, guys. In carpal tunnel, important is the nerve. So which nerve is passing from the carpal tunnel, guys? The nerve which is passing from the carpal tunnel, it is the median nerve. So if a person is having carpal tunnel syndrome, the person will have median nerve injury, right? Carpal bones we have already discussed, guys. So in carpal bones we are having scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. If you will have this PDF, you will see the all important things which can come from the carpal bones. Only one thing which is not present here is what, guys? The X-rays. The last thing which they can do from this carpal bones is what, guys? They can give the X-ray, and what they will do, They will put arrow like this in any bone and they will ask what is the name of this. Most commonly they will ask the lunate. Done. She looks too pretty. Try to get. Can you tell me who is this? Now we are having 5 minutes break. In after 5 minutes, we will study the last topic. That is what, guys? That is the brachial plexus and five major nerves. This will be our last topic for today. Then we will bind up the session. Okay. First of all, guys, in brachial plexus, what is brachial plexus? Brachial plexus is your network or the group of nerves which are present on where, guys, which are going to supply to the upper limb, right? The origin of this brachial plexus is what, guys? The origin of the brachial plexus is your ventral rami of C5 to T1. C5 to T1 is what, guys? C5 to T1 is your roots. What I am trying to say, you guys, this brachial plexus is having some parts. How many parts are there in brachial plexus, guys? Total we are having 5 parts in the brachial plexus. Alright? What are the names? Names are roots, trunk, divisions, cords, and branches. These are my 5 parts of brachial plexus. How to remember it? We can make a tree for this, guys. So we are having the roots, then the trunk, then the divisions, then the cords, and in last we are having what, guys? In last we are having the branches. Right? This is what, guys? This is something looking like a tree. So from tree you can write roots, trunk, divisions, cords, and branches. Everyone is having different way to learn brachial plexus, guys. My way to learn brachial plexus is to make a story. So whenever I see some difficult thing in my life, what I do, I remember it with the story. What kind of story I make? Let's let's do it together. So first of all, what we are going to do. So what I want right now with you guys is take notebook or in your iPad also you can open the second screen and draw it with me. So if you will draw this with me, you will remember it better way, right? First of all, what we are going to write, we are going to write this 5 parts. So we are having roots, then trunk, then divisions, then cord and branches. Okay, we already know the roots. Roots are what, guys? This is C5, C6, C7, C8 and T1. These are what, guys? These are my roots. Now let's start a story. C5 and C6 are my upper class society people. C8 and T1 are my lower class society people. And C7 is what, guys? C7 is, okay. What will happen, guys? Upper class will marry with each other. Lower class will marry with each other. And this person will also be single. But when this person is single, this person will adopt the babies. So after getting married, two souls, one body, right? दो जिस्म एक जान. अब इस दो जिस्म एक जान से दो दो बच्चे हो रहे हैं. One is on the anterior, another one is posterior. Anterior one is boys, posterior one is girls, right? Anterior one and the posterior one. Same, the C7 will also have two babies. One will be the anterior one and another one will be the posterior one. Same for lower class society. I hope you all are drawing with me, guys. Otherwise, there is no use of this. Everyone is having two babies, anterior baby and posterior baby. Before that, this is my superior trunk, this is my medial trunk, and this is my inferior trunk, right? Now, what will happen, guys? This boy will fall in love with this boy. So, anterior branch of C7 will fall in love with anterior branch of C5 and C6. What they will decide? They will decide to be together. So my anterior branch is deciding with this anterior branch to be with each other, right? What about the girls? Right? And because this guy is watching all of them, this guy will think, better I leave alone. So these are my what, guys? These are my codes. Roots, these are the trunks here. Then I am having the divisions. Now I am doing what? I am doing the codes. What are the names of these codes, guys? So these two anterior branches will give me the lateral chord. All three posterior branch will give me the posterior chord, and the last one will what, guys? Last one will be the medial chord. Done. Now, next in the story, this boy will what say to this boy so that they both will fall in love with each other. Le le mera love, right? Take my love. That's how he's going to say, and they both will fall in love with each other. Posterior was what, guys? Posterior was the girls, right? Girls are having beautiful face like moon. Another name of moon is what, guys? It is lunar, right? And who is giving you this trick? This trick is given by Mudit sir, right? Mudit sir is always for you and for you. These are what, guys? These are my branches. We will discuss the branches later, but before that, what we are going to do? We are going to study some extramarital affairs of these roots and the trunks, right? First of all, let's discuss about C5. तो C5 का कहीं और भी चक्कर चल रहा है भाइयों. और क्या चक्कर चल रहा है इसका? इसका चक्कर चल रहा है डोर्सल स्कैपुलर नर्व का. So this dorsal scapular nerve is the branch of what, guys? This dorsal scapular nerve is the branch of C5. इन तीनों का भी चक्कर चल रहा है, C5 C6 C7 का, एक दूसरे के साथ। और ये इस चक्कर का क्या नाम है? The branch which is coming out from C5, C6 and C7, it is your long thoracic nerve. This long thoracic nerve is also known as nerve to serratus anterior muscle, right? And another name is nerve to bell. Long thoracic nerve, nerve to the serratus anterior, and nerve to bell. All these three are the names of a single nerve, right? And this nerve is supplying to, of course, it is in the name only, it is supplying to the serratus anterior muscle. Anything which you should know about serratus anterior muscle, guys, can you comment it down? Serratus anterior muscle is also known as which muscle, guys? Yes, it is what, guys? It is the coxus muscle. Now let's come to the superior trunk, guys. On the superior trunk, I am having two different nerves. One is on the upper side, that is suprascapular nerve, and the nerve which is coming from the down, that is what, guys? Nerve to subclavius, right? So from upper side it is suprascapular nerve, and from lower side it is nerve to the subclavius. One more nerve is going to come here, guys. This nerve is coming from the behind of this nerve to the subclavius nerve, and the name of this nerve is what, guys? The name of this nerve is accessory phrenic nerve. In this accessory phrenic nerve is going to attach with one major nerve and one very important nerve. The name of this nerve is phrenic nerve, and it is supplying where, guys? Can you tell me? Phrenic nerve is supplying to, yes, guys, it is supplying to the diaphragm, and the root value of this phrenic nerve is your final exam year question, final year question, final exam question, that is C3, C4, and C5. Okay, these are the extramarital affairs which you should know. Total how many in number? Now, extramarital affair number 1, number 2, number 3, number 4, fifth का first part and fifth का second, right? So this much you should know about extramarital affairs of brachial plexus. Now let's come back to the branches, guys. So what we are going to do, we are going to write the branches as well as the root values of these branches. Okay. First of all, we are having the branches from the lateral cord. क्या पढ़ा था lateral cord के बारे में? What was the mnemonic? Lele mera love, right? LML. First L is what, guys? It is your lateral pectoral nerve. Then M, it is what, guys? It is your musculocutaneous nerve. The third L is what, guys? It is your lateral root of median nerve. Lateral root of median nerve. All these are the branches of my lateral cord, and they all have the same root value, guys, and the root value is C5, C6 and C7. These are the root value of my branches which are coming out from lateral cord. Next is what, guys? Next is posterior cord. Posterior cord is about what, guys? Posterior cord is about the girls, and we all know that all girls are beautiful, right? And beautiful like moon, lunar, Lunar. What are these, guys? From L and U, that is your lower and upper subscapular nerve. Then N, guys, this N is very important. I love this N. I will ask you about this N. N is what, guys? This N is your nerve to latissimus dorsi, also known as thoracodorsal nerve. It is the nerve to the latissimus dorsi, which is also known as thoracodorsal nerve. Okay, so tell me about something about this muscle, guys. So this nerve is supplying to latissimus dorsi, right? Tell me something about latissimus dorsi, guys, which is important. So what are the another names of my latissimus dorsi? Gayatri ji. Okay, okay. So the nerves to the latissimus dorsi is what, guys? The nerves to the latissimus dorsi is supplying to latissimus dorsi muscle, and this latissimus dorsi muscle is known as climber's muscles. It is known as what, guys? It is known as climber's muscle, as well as it is the broadest. भाई broadest की spelling देख लेना, हो सकता है मैं गलत लिख दूं. It is the broadest muscle of human body. Important, guys, important. Broadest muscle of the human body is what, guys? It is latissimus dorsi. If someone is asking you what is the broadest muscle of the human body, don't use your 18 plus brain and don't say it is gluteus, guys. It is not gluteus. It is your latissimus dorsi. Okay. Then we are having A. A is for what? A is for your axillary nerve, and R is for what, guys? R is for radial nerve. All these are what, guys? All these are the posterior cord branches. LUNAR, lower and upper subscapular nerve, nerve to the latissimus dorsi, also known as thoracodorsal nerve. Then we are having axillary nerve and radial nerve. Now, what are the root values of this, guys? So for root values, what you are going to do, guys? For root values, you are going to divide this lunar into LUA, lua, and R. That's how you are going to divide this, guys. So lua is having the same root value, N is having one root value, and R will have the another root value. So all these three are going to have different root values. What is the root value for the lua, guys? Lua is what? Lower and upper subscapular nerve as well as the axillary nerve. All of them are having the root value, that is what, guys? C5 and C6. What about nerve to the latissimus dorsi? Nerve to the latissimus dorsi is going to have C6, C7 and C8. And radial nerve, guys, radial nerve is the largest nerve of your upper limb. It is the largest nerve of your upper limb. It is the largest nerve of your upper limb, and the root value will be also the largest, which is what, guys? Which is from C5 to T1. So it covers all the roots from C5 to T1. Okay. Now the last is what, guys? The last is median cord of the brachial plexus. This medial cord is what, guys? This medial cord is, of course, myself, that is Dr. Mudit sir, is for you. What is M for you, guys? Total we are having 4 M's and 1 U. First M is what, guys? First M is medial pectoral nerve. Second is what, guys? Second is your medial root of median nerve, medial root of median nerve. Third is what, guys? Third and fourth are for the same, guys. That is your median cutaneous nerve. One is for the arm, another one is for forearm. So median cutaneous nerve of arm, median cutaneous nerve is of forearm, and U is what, guys? U is your ulnar nerve. U is your ulnar nerve. Okay. Let's revise all the nerves, guys. So branches which are coming from the branches which are coming from the lateral cord, it is what, guys? It is lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. All these are having the same root value. That is what, guys? That is C5, C6, C7. Then branches from the posterior cord are what, guys? That are lower subscapular nerve, upper subscapular nerve, nerve to the latissimus dorsi, that is thoracodorsal nerve. A is what, guys? It is axillary nerve, and R is radial nerve. Out of them, what you have to do, you have to make LUA and R. LUA is C5, C6, and which is nerve to the latissimus dorsi. Latissimus dorsi is what, guys? Latissimus dorsi is Kleinberg's muscle, as well as it is what, guys? It is the broadest muscle of your human body. This nerve to the latissimus dorsi is going to supplied by the three roots, that is C7, C6, C7, and C8. Last is what, guys? Last is the radial nerve. Important to know about radial nerve is what, guys? It is the largest muscle of your upper limb. It is the largest nerve. It is the largest nerve of your upper limb, that is from C5 to T1. Then we are having medial cords. First M is what, guys? First M is medial pectoral nerve. Second is medial root of median nerve. Third and fourth are what, guys? They are medial cutaneous nerve of arm and forearm. They are what, guys? They are medial cutaneous nerve of arm and forearm. And the last one is the ulnar nerve. And the last one is what, guys? Ulnar nerve. What about the root values, guys? All these four M will have same root value, and this root U will have same root value. So all these four M are having C8 and T1, and this U is having C7, C8, and T1. Done, guys. I hope everything is covered here about the brachial plexus. Now let's the clinical aspect of this, guys. So why we should know the brachial plexus? Because in brachial plexus we are having one thing. This thing is known as Erb's point. What is Erb's point, guys? The Erb's point is present where it is present in the upper trunk. Upper trunk is what, guys? Our upper class society, right? That is your Erb's point. And in this upper trunk, we are having 6 nerves which are going to meet with each other. See, guys, this was my upper trunk now. So C5 and C6, they both were getting married. Then दो जिस्म एक जान, 2 souls, 1 body. Then we are having what? 2 babies, right? Anterior baby and the posterior baby. And upper trunk is having some extramarital affairs also. What are these? That is, anyone? What are these, guys? I have told you just few seconds before. Upper one and the lower one from the upper trunk. What are the names? सो गए हो क्या बच्चों? चलो कोई बात नहीं, मैं बता देता हूँ. So the upper one is what, guys? Upper one is suprascapular nerve, and the lower one is nerve to subclavius. Upper one is suprascapular nerve, and the lower one is nerve to subclavius. Can you see this red color circle, guys? This red color circle which I am making here, it is my earth point. Here I am having these six nerves: one, two, three, four, five, six. All these six nerves are going to meet with each other, right? All these six nerves are going to meet with each other. This is my herbs point. If any kind of injury will happen to this, so if any kind of injury will happen to this point, this kind of injury is known as herbs paralysis. Very important for your final exams, guys. What is herbs paralysis? In herbs paralysis, we are going to have the injury of the upper trunk of the brachial plexus, of course, right? In that, we are going to have the nerve roots which are going to get affected. So the nerve roots which are going to get affected, it is what, guys? It is your C5 and C6, right? The nerves which are involved, the nerves which are involved here, they are what, guys? They are axillary nerve. Total three are in the total. We are going to have three nerves, guys. So the first one is axillary nerve. The second one is musculocutaneous nerve, and the third one is suprascapular nerve. These three nerves are going to get affected in my what, guys? These three nerves are going to get affected in my Erb's palsy. Now, in my Erb's palsy, what all things are I am going to see, guys? Can you appreciate this diagram? So in this diagram, guys, what you can see, we have to see four things. First of all, we are going to see the arm, then we are going to see elbow, then we are going to see forearm, and the last one which I am going to see is what, guys? Fingers, right? So can you see this arm, guys? The arm is what, guys? It is adducted and medially rotated. Adducted and medially rotated. So the arm is going to have adduction and medial rotation, right? What about the elbow, guys? This elbow is going away, right? This elbow is getting extended elbow. What about the forearm, guys? Forearm is going to have pronation, pronated forearm. Last is fingers. Fingers will be my flexed fingers. Fingers will be my flexed fingers, right? Plus, what else you can see, guys? The redness on the anterior side of the arm. Plus, you are going to see redness on anterior side of arm. Okay, all these things you are going to see where in your Erb's paralysis. This Erb's paralysis is also known as, there we are having three different names, 1, 2, and 3. The first name is what, guys? It is policeman tip deformity. The second name is waiter's tip deformity. And the third name is porter's tip deformity. All these are the names of my Erb's paralysis. Okay, guys. Now, next is Klumpke's paralysis. In Klumpke's paralysis, it is what, guys? It is the injury to lower trunk. It is what, guys? It is injury to lower trunk. What are the roots which are going to get affect, guys? The roots which are going to get affect is C8 and T1. What are the nerves which are going to get affect? The nerves are my median nerve and ulnar nerve. These are the things which are going to get affected my Klumpke's paradox. Done. Now the next thing which we are going to have is what, guys? The topic which we are going to start is five major nerves. It is very important topic, guys. I am going to definitely ask you this five major nerves, and every single line in this five major nerve is your FMG exam question, guys. It is very important for that also. I hope you all are here. Around 15 students are here. Good. Thanks to you all. तुम 1 बजे भी मुझे देख रहे हो. You are watching me at midnight, 1 o'clock also. Thank you so much for that. Let's compile this, guys. Maximum 15-20 minutes more we will take, and then we will finish this session. So these five major nerves of the brachial plexus, guys, these are going to divide it in your arm, forearm, and the muscles of hand. So we already have studied about the arm, that arm is going to have two compartments, that is what is anterior and posterior. Forearm is also going to have two compartments, again anterior and posterior, right? And then we are and and then we are having shoulder also. So in shoulder we are having one muscle, that is axillary muscle. अरे यार क्या बोल रहा हूँ? One muscle, that is deltoid muscle. And in deltoid muscle, which is going to supplied by axillary nerve, right? What about the anterior compartment of the arm? Anterior compartment of the arm is supplied by musculocutaneous nerve, and that is your first major nerve, guys. Musculocutaneous nerve is going to supply to the anterior compartment of the arm, and anterior compartment of the forearm, it is supplied by ulnar nerve. What about the posterior compartment, guys? Posterior compartment of arm and forearm, they both are supplied by radial nerve. And then we are having muscles of hand. These muscles of hand are supplied by ulnar as well as the median nerve. Okay. Now let's study all these nerves one by one. The first one which we are going to study right now is what, guys? It is your musculocutaneous nerve. Anyone who knows about the musculocutaneous nerve, please write it down, guys, with me. You can comments, guys. Of course, I know that 70% of my students, they already know the things about the musculocutaneous, right? So let's revise it together. What is origin, guys? Origin of musculocutaneous nerve is lateral cord of brachial plexus. Remember LML, Lele Mera Love, right? Lateral cord of brachial plexus. M here is musculocutaneous. Okay. What about the roots? For LML there is single root only, and that is what guys, C5, C6 and C7. Then this nerve is supplying to what guys? It is very important. It is supplying to three muscles. What are the names of the muscles? Everyone please write the names of the muscles guys. It is supplying to coracobrachialis muscle. It is supplying to biceps brachii muscle. And the last one which you will study here is what guys? It is your brachialis muscle. Coracobrachialis muscle, biceps brachii muscle and brachialis muscle. This coracobrachialis muscle guys, what is the importance of this muscle? What I have told you about this muscle, that this muscle is going to have piercing in it. It is pierced by which nerve guys? It is pierced by musculocutaneous nerve, right? Coracobrachialis muscle is going to get pierced by musculocutaneous nerve. Then something about brachialis muscle also we should know, that brachialis muscle is going to divide into two parts. The first part is the medial half, and the second part is what guys? It is the lateral half. What about the medial half guys? Medial half is supplied by musculocutaneous nerve, and the lateral half is supplied by lateral 1.5. Nice, nice. Lateral half is supplied by radial nerve. Guys, this kind of muscles which are having two nerve supplies, this kind of muscles are known as what guys? Anyone? The muscles which are supplied by two nerves or two or more nerves, this kind of nerves are known as composite muscle. Very good bro. These are known as what guys? Composite muscles. Okay. Another name is hybrid muscles. So I can ask you, what is the name of the hybrid muscle which is present in your arm? That is only and only brachialis muscle. Understood guys? Last thing which you should know about this musculocutaneous nerve, and it is very important guys. Last thing which is important about musculocutaneous nerve, it is what guys? It is going to continue where? It is going to continue in forearm. It is going to continue in forearm, and when it will going to descend, when it will descend down to the forearm, the name will get changed. What will be the name guys? Name is lateral cutaneous nerve of forearm. The name will be what guys? The name will be lateral of name will be lateral cutaneous nerve of forearm. Done guys? Now the second nerve, the second major nerve which we are going to cover, it is what guys? It is axillary nerve. The second nerve which we are going to cover, it is axillary nerve. Where we have studied the axillary nerve guys? Axillary nerve is the branch from posterior cord. Axillary nerve is the branch of what guys? It is a branch of posterior cord. Let's write guys. So axillary nerve origin is what guys? posterior cord of brachial plexus, right? What was the mnemonic for the posterior cord? Posterior cord were the girls, and girls are beautiful. That's why the beautiful face is known as lunar. Out of name, this A is what? It is axillary nerve. So about this, what we have studied in lunar, we have lua, N and R. लूवा में से ए क्या है गाइस? ए व्हाट इज द रूट वैल्यू? द रूट वैल्यू इज C5, C6. The root value is C5 and C6. Now, what are the muscles? Here the muscles are very important, guys. The muscles which are going to supply, which were which will get supplied by axillary nerve. The names of the muscles are, first one is deltoid muscle, and the second one is टेरिस माइनर मसल. शाबाश बच्चों, अब जाके तुम एक्टिव हुए हो. रात में 1:15 बजे तुम्हारा दिमाग दौड़ने लगा है. In night 1:15 your brain starts getting activated. All of you are so night persons, guys. Congratulations, we are on the same page. So the muscles are deltoid muscle and teres minor muscle. Teres minor muscle we have already discussed up above session, okay, in previous hours. Now we will see about this important muscle, that is what guys? Deltoid muscle, my favorite exam question. Deltoid muscle is what guys? So let's write the deltoid muscle as a new topic only. The deltoid muscle is going to have three fibers. What are these three fibers guys? Anterior fiber, lateral fiber, also known as middle fiber. It is MIDDLE guys, not MEDIAL. Okay? Lateral or the middle fibers, anterior fibers, and on back we are having posterior fibers. So total three fibers are there. Let's make a table about these three fibers guys, which we want to know what guys? We want to know origin, insertion, action, innervation, all those things, right? And the nerve supply. So let's make a table. In this table we are going to write the anterior fibers, lateral fibers, and posterior fibers. So guys, what about anterior fibers? The Okay, first of all we are going to write origin of all these things. Then we are going to have insertion. Then we are going to have the nerve supply. And at last we will do what? At last we will do the action thing. Origin of anterior fibers is what guys? Origin of anterior fiber is clavicle. Where in clavicle guys? It is lateral 1/3 of clavicle. It is lateral 1/3 of clavicle. What about lateral fibers guys? Lateral fibers are going to originate from acromion process. At the last we are having posterior fibers. These posterior fibers are going to originate from spine of scapula. Great, bhai, great. Incision will be same, guys. Incision will be same for everyone. And this incision is what, guys? The incision is your deltoid tuberosity. Where we have studied this deltoid tuberosity, guys. So we are having this humerus, the head of the humerus, greater trochanter of the humerus, lesser trochanter of the humerus, surgical neck, anatomical neck of the humerus. Then we are having this shaft of the humerus. In between, we are having intertubercular sulcus. Then in shaft of the humerus on the anterior side, on the anterior side, this is deltoid tuberosity. On the posterior side, we are having what? We are having the radial groove from where we are going to radial nerve passage. Okay? Radial nerve is going to pass from radial groove which is present on the posterior side of shaft of humerus. Nerve supply again, guys, what which nerve we were studying? We were studying axillary nerve, right? So the nerve supply is axillary nerve. Now the actions, guys. Actions are again different for everyone. For the anterior fibers, it's different. For the lateral fibers, it's different. And for the posterior fibers, it's different. For anterior fibers, the actions are flexion and medial rotation. In the lateral fibers, we are having abduction of arm. Usually, it will be from 15 to 90 degree. Usually, it will be from 15 to 90 degree. And the last is what, guys? Last is your extension and lateral rotation. Extension and lateral rotation of arm. Extension and lateral rotation of arm. Done, guys. Now let's see the abduction of arms, guys. So in abduction of arm, we are having 0 to 15, 15 to 90, and more than 90. 0 to 15 we have already studied. It is supraspinatus muscle, right? 15 to 90, it is what, guys? It is your lateral fiber of deltoid muscle or the middle fiber of the deltoid muscle. And more than 90, it is done by what, guys? More than 90 is done by two different muscle, that is trapezius muscle and serratus anterior muscle. Trapezius muscle and serratus anterior muscle. Okay, guys, tell me, trapezius muscle is supplied by what and serratus anterior muscle is supplied by what? So the trapezius muscle is supplied by cranial nerve. The number of the cranial nerve is waiting for your replies, guys. Cranial nerve number 11. What is the name of this nerve, guys? Number 11 is known as spinal accessory nerve. Spinal accessory nerve, right? What about serratus anterior? It is the extramarietal affairs of the brachial plexus. Extramarietal affair of C5, C6 and C7. We call it long thoracic nerve, right? We call it long thoracic nerve. Very good, guys. What will happen if this deltoid muscle will get injury? So in exam, they will not give you directly that deltoid muscle is injured, right? Instead of that, they will write something else. So what an examiner can write about deltoid muscle? Or axillary nerve injury. So for deltoid muscle or axillary nerve injury, examiner can write these 4 points. All these 4 points are very, very important and my favorite point. If you are telling me this in the final exam, I will get happy. Only after I will ask you. If you will tell it before, then you know it is. So guys, the first thing which examiner can write, it is what guys? It is atrophy of deltoid muscle. If axillary nerve will stop giving the impulses to deltoid muscle, the size of the deltoid muscle will get smaller, which is known as atrophy of the deltoid muscle. Second is loss of rounded shape of deltoid muscle. Again, the same thing, deltoid muscle is not working, it will get thin. Once it will get thin, this roundedness which is given by the deltoid muscle will get lost. The third thing is weakness in abduction of arm. It is what guys? It is weakness in abduction of arm. Just now we have studied about the serratus anterior muscle, that is from 0 to 15 degree, but yeah, serratus anterior supraspinatus muscle, that is from 0 to 15 degree, and the lateral fibers of the deltoid muscle, that is what guys? That is from 15 to 90 degree, right? Last and very important guys, if you are giving FMG exam or even in INI CET exam, the exams which is the most toughest exam for India for doing the PG, that is for the AIMS, right? Call it INI CET exam. In that exam also, this question has asked, that is what guys? That is very good, bro. Vaibhav, Vaibhya, जो भी regimental sign. That is regimental sign. What is regimental sign, guys? Regimental sign is the loss of sensation, where loss of sensation in upper lateral side of arm. Loss of sensation in upper lateral side of the arm. There you are going to lose the sensation. In this place, our military persons put the regiments, put the badges, right? That's why we call it regimental sign. Great. Now let's do the third nerve. This third nerve is what guys? The nerve is median nerve. The third nerve is median nerve. Median nerve is also known as what guys? It is also known as, लिखो लिखो guys, कौन सी होती है? Also known as laborer's nerve. It is also known as laborer's nerve. Another name of the median nerve is what guys? This is also known as eye of hand. So which nerve is known as the eye of hand? It is your median nerve, right? What you should know about median nerve guys? Again, the origin. Here, don't get confused, guys. So in brachial plexus, we have studied two things about the median nerve: lateral root of the median nerve and medial root of the median nerve. So one is coming from the lateral cords, another one is coming from the medial cords. So in origin, what you are going to write? In origin, you are going to write the lateral and medial cords of brachial plexus, right? That is your origin. So if it is coming out from the lateral cord and the medial cord, right? So in lateral cord it is having different root value, and in medial cord it is different root value. Can you tell me lateral root of median nerve, what is the root value, and the median cord of the median nerve, what is the root value? If you will combine them, it will be same like your radial nerve. C5, C6, C7, C8 and T1. So lateral is C5 to C7 and another one is C8 to T1, right? Now it is supplying to what, guys? When I will ask you supply of your ulnar nerve and the median nerve, here I will cover the muscles of anterior compartment of your forearm, right? Because it is supplying where? It is supplying to forearm. Even in forearm, all muscles of anterior compartment, which we have already discussed above, except what, guys? Except medial half muscles. Except the medial half muscle. What are these medial half muscles, guys? These medial half muscles are flexor carpi ulnaris and flexor digitorum profundus. Flexor carpi ulnaris and flexor digitorum profundus. These two are what, guys? These two are medial half muscles on the anterior compartment. Medial half muscles on what, guys? On anterior compartment of forearm. Okay guys, यार 2 मिनट का ब्रेक लेते हैं. एक आधा बच्चा कमेंट कर दो यार प्लीज, ताकि मुझे पता पड़े. बढ़िया. चलो, फ्लेक्स डिजिटोरम प्रोफंडस, इसके बारे में गाइस कुछ चीजें जो तुम्हें पता होनी चाहिए. दिस flexor digitorum profundus is also what, guys? It is also hybrid muscle. Flexor digitorum profundus, it is also what, guys? It is also hybrid muscle. It is also having medial half. It is also having medial half and lateral half. Okay. Medial half is supplied by ulnar nerve and the lateral half is supplied by median nerve. Medial half is supplied by ulnar nerve and lateral half is supplied by ulnar nerve. Great. ये हो गया तुम्हारा मीडियन नर्व के बारे में. नेक्स्ट इज अल्नार नर्व. कौन से नंबर की है? फोर्थ. फोर्थ वन इज व्हाट, गाइस? अल्नार नर्व. Ulnar nerve is also known as what? Ulnar nerve is also known as one very important name, that is, स्पेलिंग देख लेना यार, हो सकता है गलत हो. म्यूजिशियंस नर्व. म्यूजिशियंस नर्व. Guys, so ulnar nerve is also having origin, then root value, and then supply. Origin is what? Origin is lateral and, sorry, origin is medial cord of brachial plexus, right? Medial cord में क्या पढ़ा था अपन ने? Mudit sir is for you, right? U is what? U is ulnar. Then what will be the root value, guys? Root value will be 7, 8 and T1. Root value will be 7, 8, T1. What will be the root value of M4? That is median pectoral nerve, median root of median nerve, median cutaneous nerve of forearm, and median cutaneous nerve of arm. The root value is C8 and T1. C8 and T1. It is supplying to forearm. See guys, easy कर देते हैं काम, है ना? जो मसल्स हमने यहाँ पे एक्सेप्ट में लिखी है ना, except the medial half muscles, these medial half muscles are going to be supplied by what? Ulnar nerve. Okay, so it is supplying to medial 1.5 muscles of anterior compartment of forearm. It is supplying to anterior compartment of forearm ka medial half muscles. Done. Names are here already. We have discussed it. Okay. Flexor carpi ulnaris and flexor digitorum profundus. Flexor carpi ulnaris and flexor digitorum profundus. Now the very last nerve. खत्म होने वाला है बच्चों. Congratulations. मजे आ गए. The very last nerve is what? It is radial nerve. रेडियल नर्व के बारे में एक बात क्या बताई थी मैंने तुम्हें? इट इज द लार्जेस्ट नर्व ऑफ brachial plexus. Is the largest nerve of brachial plexus, plus the maximum root value will be shared by radial nerve, that is from C5 to T1, right? It is supplying to what, guys? It is supplying, सप्लाई लिख देता हूँ यार, मेरे को सप्लाइंग की स्पेलिंग नहीं आ रही. इट इज सप्लाई टू posterior compartment of arm as well as posterior compartment of forearm, right? In posterior compartment of the arm, majorly it is going to supply to triceps muscle. In this we are having three heads: long head, medial head, and long head, medial head, and lateral head. Long head, medial head, and lateral head. Out of them, which one is the largest one? Medial is the largest. Okay. Medial head is what, guys? It is the largest one. What about forearm, guys? In forearm, total we are having how many muscles? We are having total 9 muscles. 9 muscles of forearm. What are these 9 muscles of forearm, guys? We have already studied it. So these 9 muscles of the forearm are going to divide into superficial muscles and deep muscles. I already taught you in this lecture. I want you all to answer now. So what are the superficial, posterior superficial muscles of forearm? Let me know, guys. So all these muscles will be extensors muscle, and there will be one abductor also. Come on, come on, come on. Give me the superficial posterior muscles of forearm. आंसर करो, फिर हम इसको फिनिश करते हैं गाइस, कम ऑन। और शादी एक साथ में लिख दी, क्या बात है, शाबाश। इट इज एक्सटेंसर कार्पी अल्नारिस, राइट? Then you are having two radius, extensor अच्छा, extensor carpi radialis longus, extensor carpi radialis brevis. The fourth one is extensor digiti minimi, and the fifth one is extensor digitorum. These are superficial muscles. Okay. In deep, we are having four muscles. What are these, guys? Out of them, three are extensors, and one is abductor. Waiting for the answers, guys. So the first one is extensor indicis. Then we are having extensor pollicis brevis, extensor pollicis longus, and abductor pollicis longus. Indicis, pollicis brevis, pollicis longus, longus. One is extensor, one is abductor. Okay, guys. Done. Last thing, very, very, very last thing, guys. It is the nerve supplies, right? So we should know the nerve supplies of your hand also. Sensory supply of the hand. Let me bring one photo, guys, so that we can finish this also. तो पुरानी वाली आ गई. This one. What we are going to study here, we are going to see sensory supply of hand. In this sensory supply of hand, we are having medial half, which is supplied by the ulnar nerve, and lateral 3 by 2 is supplied by. उल्टा नहीं लिख दिया ये. Medial 1/3 and lateral 2/3. Medial 1/3 is supplied by ulnar nerve, and the lateral 1/3 is supplied by median nerve. Okay. On the posterior side, the thing which I am highlighting, guys, this is supplied by the radial nerve. So on the posterior sides, we are having three nerves. Medial 1.5 will be digit will be your ulnar nerve. Lateral 3.5 digit will be your digit कहाँ तक बेटा? Till the distal phalanges. The first phalanges of your posterior side, the skin which is above the first phalanges, it is supplied by the median nerve, and other than that, the whole thing is supplied by radial nerve. Okay, I hope you all liked it, guys. We have done a great job. हमने खत्म कर दिया इसको. थैंक यू ऑल वेरी मच, गाइज. तुम अभी तक मेरे साथ में बने हुए थे. थैंक यू सो मच. कैसे जाना है? ऐसे ही जाना है या कुछ बातें बातें करके जाना है? बता दो यार, कैसी थी? हाउ वाज दिस लाइव? ऑल यू गाइस लाइक्ड इट और नॉट? मैं अपने आप को बड़ा कर लूँ क्या? बताओ. हाउ वाज द लाइव, गाइस? एवरीथिंग वाज फाइन? ऑल यू गाइस लाइक्ड? कहीं पे बीच में लैग तो नहीं हुआ? मेरी आवाज़ बंद तो नहीं हुई? एसआरएच जीत गई. कॉन्ग्रेचुलेशंस भाई. किसने बनाया था? अभिषेक ने बनाया क्या? नीड मोर पे अपन यार और काम कर सकते हैं, देखो। कल ही कर लें क्या एक और लाइव? लोअर लिम कल खत्म कर देते हैं, क्या बोलते हो? अपर लिम हो जाएगा, लोअर लिम भी हो जाएगा, फिर सिर्फ हेडेक और जीआईटी बचेगा। अगर यूट्यूब में क्लास के जोक्स मार दिए बेटा तो स्ट्राइक आ जाएगी। कल कर लें एक और लाइव। बढ़िया बढ़िया, बताओ कितने बजे करना है? डिसाइड कर लेते हैं। शुड वी डू ऑन द सेम टाइम? अरे भाई कॉफी तो आई जस्ट, जेसिका, आई जस्ट हैड वन कप ऑफ कॉफी। आफ्टर दैट आई वाज हैविंग ग्रीन टी विद लेमन। सेम टाइम बेटा, मंडे को मुझे 8 बजे रिपब्लिकन पे भी पहुंचना है। चलो मैं पोल डाल दूंगा। अभी तो पहले सोएंगे, सो के उठेंगे, उसके बाद में देखते हैं, है ना? अगेन थैंक यू वेरी मच फॉर बीइंग विद मी, ऑल ऑफ यू गाइस। हैव अ नाइस टाइम, बाय, गुड नाइट, स्लीप वेल, ड्रीम वेल। सुबह उठ के एक काम करना, जो भी मैंने पढ़ाया है प्लीज प्लीज रिवाइज कर लेना बच्चों। एग्जाम्स आर कमिंग वेरी नियर, आई वांट यू ऑल टू गेट पास, फॉर दैट आई एम डूइंग दिस मच hard work so that you can have my lectures at your home on your bed, right? You just need internet for this. I really want you all guys ready to pass in first attempt.